Hello, this is Dr. Bob Browner with update number 12. Today we'll talk about the latest data, what I see as the weakest link in our efforts, and but also potentially the long-term silver lining in what we're going through. So latest data comes from a couple areas. I do use the state site, although unfortunately it's a little behind. Surprisingly, the New York Times gets data faster than our state site does. I did verify this. Libby Crockett sent me the Hall County numbers yet last night, and they actually conform with the New York Times site. So hopefully our state will start getting the state site updated a little more quickly. So I'll use the data mostly going by what is pulled out of New York Times, which I have verified as accurate. I do like how they graph this increase because this is where we're at right now. We're on the uptick. And likely it's a little underreported because of lack of testing, although I do think we're going to get some more testing up and running already and then in the next week. So this will get us a better idea of how we are in Lincoln. Again, across the state, how are we doing? Again, what you're seeing is the results vary. Lincoln and Lancaster County has the lowest population positive rate, although our testing is still a bit limited. Grand Highland, Hall County, unfortunately, is not looking as good. They are they're probably our hotspot, and we'll talk a little bit about why became our hotspot. Hopefully, they'll get on top of things. I did talk to some doctors there earlier this week. Their ICU is already full, so they may be having to ship patients to other regional hospitals. The problem is the chink in the armor, I believe, in the Midwest is probably our meatpacking plants and some other facilities. They were judged as essential industries and weren't asked to close or change much, unfortunately. And they should have, although they maybe we need to keep them open, but we need to make sure we still have the social distancing, adequate masks, hand sanitizer, whatever. But unfortunately, in Grand Island, the JBS plant may have been the source of some of the spread, just like up in Sioux Falls, it was the Smithfield plant. This is concerning to me because we actually have two Smithfield plants and a poultry plant within Lincoln's radius, so could be the chink in our armor here in Lincoln as well. I have talked to a city councilman and a county commissioner about this, so hopefully they're looking into that to make sure that they don't become the source of an outbreak here in Lincoln. The other concern I have is that a lot of the employees of these tend to be our minority and immigrant community, and when things go wrong and mistakes get made, people tend to find the nearest scapegoat. So I hope they don't try and blame the Hispanic or the Somali communities for this outbreak when really it was the employers that probably made the mistake and didn't do what needed to be done. So hopefully we don't see scapegoating like has happened in almost every other pandemic for the last few centuries, where people tend to divert their responsibility by finding the most convenient scapegoat. This is, like I said, it's been happened before, and it is interesting to read the history to kind of give some idea of what's been going on. As bad as we think things are right now, actually, when you read the history of what happened in the epidemic 100 years ago, it was actually worse as far as how much miscommunication and how people weren't listening, and actually the press wasn't even reporting these a lot of times. The other thing what I use when I look at these numbers, I look not only where are we doing, but how are we compared to New York and or United States averages. And so what you'll see here is that the state of Nebraska is still much lower than U.S. averages, although our testing rate is lower. So I'm not sure how good our data is. It does suggest that at least as on average in Nebraska, we're doing better than the rest of the country. Unfortunately, of course, Hall County and Grand Island and a little bit even in Hastings, their numbers seem to be higher and could be approaching New York. Hopefully not as bad as New York. So this is what we want to do is avoid becoming a New York. They've already got 14,000 deaths as of this morning. This is quite a lot. My daughter and her roommate are back from New York, and they're doing online classes. When they talk to their classmates in New York, almost all of them know either an older relative or family friend that have died, and so this is really going to affect New York in a tough way. If you look at it, 14,000 deaths in New York, that's actually more than 5 times what the New York, the World Trade disaster in 9/11. So this is orders of magnitude worse than what happened in 9/11. So this is not a small deal. The other reason I look at these deaths and is to try to back calculate how many positives we actually have. If there's a 1% case fatality rate, that means for every death there's at least 100 more cases. So that would, if you use that number, you'd say we actually probably have at least 2,200 cases in Nebraska, not 995. Some are estimating that there's actually even more asymptomatic spread, where a young healthy person has the virus but doesn't have many symptoms. You could have 2 to 4 times that many. So that tells us our state rates probably anywhere from 0.1 to 0.5%, or 2 to 9,000 cases. But if you look at New York, it means their population infected is probably in the 7 to maybe as much as 29, which is 30%. Why that's important is that helps inform our projections for the state. So you keep hearing all these really, really wide projections. Is it going to be 100,000 dead in the United States? Is it going to be 2 million? It has partly to do with this infection rate. And so if we see that New York is already approaching this 30% range, that's what we could have in Nebraska if we don't get it right. So it's important for us to not get it right. We need to keep this up for a while because it would prevent the deaths of 1,000 people in Lincoln or a deaths of 6,000 people in Nebraska. It's worth our effort to prevent that many people from dying and keep us skewed toward this end and not over to this end. This also assumes a case fatality rate of 0.5 to 1%. Unfortunately, there's some data from Germany and South Korea may actually higher. It could be 2%, so it could be worse. Again, we need to make sure we stay in this range and not repeat the mistakes of New York. Um, Lastly, though, I want to talk a little bit about a potential silver lining and where we're going to go next. A friend of mine in the neighborhood, Tracy, sent this article to me, and I've been reading it about once a week just because it really makes you think about where are we going as a society, what's really important in life. It's an article every time you read it, you think a little bit differently about it. The two things that are grabbing me now, one is that the fact that the credibility of our media is so bad that people don't know where to turn to for facts. The fact that you're listening to me right now might mean that you're not worried about what you're reading in the newspaper. The good news, though, is as bad as you may think it is today, it was a lot worse 100 years ago. Even in Philadelphia, in the midst of their epidemic, the newspaper wasn't even reporting about the influenza epidemic, despite thousands of Philadelphia people dying. They were told not to report. They didn't really have freedom of the press back then. So we have a lot more access to information than you might think. So as bad as we think it is, it's actually better. One thing that grabbed me is that lately, although our hospitals seem to have enough protective equipment, I'm hearing from our clinics they still can't get enough protective equipment. So here we are spending more money than any other healthcare system in the world, and we can't make sure that our doctors and nurses and respiratory therapists and receptionists have enough masks and gowns. This is a problem. It shouldn't be a problem. We shouldn't have to be asking for volunteers to sew masks for our hospital with the amount of money we're spending on healthcare. We also shouldn't have to have our doctors writing op-eds in the paper like this to get attention. Now, the fact that our papers did report these op-eds is a good sign, and they have been getting attention. So I'm happy to see that when we have physician leaders standing like this, and that it is garnering some attention for folks. And then the next thing, of course, we have to do is what's our plan next. And I think the planning on how to do next could make our healthcare system better, not just so we can do a good job with coronavirus, but could be better in the long run. So when do we reopen? Basically, the state can safely proceed when, one, we can test enough people, and we are starting to get enough tests. So I'm optimistic that in the next week or two we will finally get enough. Then when we can see that sustained reduction, then we can consider opening back up again. So these testing sites, we have two up and running in Lincoln, up on North Star. CHI has one up and running there, and then LifePoint, and there may be a third. Sounds like Grand Island finally is ramping up its testing, and so we are now opening up to not just high-risk people. So if you think you may have coronavirus, call your doctor, and they may be able to get you tested now. So hopefully we'll ramp up those numbers and get some better data. What we have to sue is like in this response from Tom Frieden, the plan is we got to see that our numbers have peaked. Once we see them peak and start dropping, then we can talk about opening back up again. But to open back up again, we have to have a plan to close again on a rapid notice. Because if we can do it on a timely basis, we could close for maybe 2 to 4 weeks and not for 8 to 12 weeks like we probably will right now. So we want to have a plan in place so we can get on top of things really quickly in a very orderly fashion, close it and then stop it and open right back up again. So hopefully we can get to that point. That's going to require our government to work a little bit differently, though. We need to have everybody working together, and so I would say the three-legged stool of this response in Lincoln is going to have the public health, meaning our health department, our primary care physician networks, and our schools all working together on an organized plan. We could have point-of-care testing in our primary clinics and even our schools possibly. And so when a symptomatic person, and once we're open back up again, if a symptomatic person were found to be positive, we could know within an hour and have everybody alerted very quickly if we have an organized plan and a mechanism put in place. To get there, we'll need to have the government start acting as a neutral convener again. It's something that we've done in the past but have not been doing lately, much to my frustration. We have a local example, Lincoln, Nebraska, where a few years back, a bunch of us were part of this, and Mayor Chris Beitler had convened this group to look at filling some holes in our healthcare safety net. Some of those holes were actually filled and made some improvements. Unfortunately, the plan didn't have full funding, so not all of it happened, but we could resurrect this model. A lot of these people are actually still around Lincoln, including myself and Dr. Spry. So we could bring this type of approach in Lincoln back together again. I wish we would. Even at the state level, we had a history for about 5 or 6 years where Lincoln, Nebraska was leading the patient-centered medical home movement. And it took a leader who actually was that neutral convener. And for a long time, that was Senator Mike Glore. And he was doing an awesome job, but then he got term limited and we had nobody to take his place. And it was bipartisan. You had Senators Mike Glore and Whiteman, who were Republicans. You had Senators Harr and Howard, who were Democrats, all part of this. We had all the insurance companies and all the medical societies all participating in this project. You had me from the Academy of Family Physicians. You had Kevin Noner from Omaha with the Nebraska Medical Association. You had Scott Applegate, who's a pediatrician here in town from the American Academy of Pediatrics. All the insurance plans were working on this project, and it was working. And it still is working a little bit. Kevin Noner later became the chief medical officer of Allegiant Health Partners ACO, which is the CHI ACO in Omaha. I started Serpa, which is Southeast Rural Physician Alliance, with some of my colleagues. We all started that. Then I went on, and now I'm serving this role at One Health Nebraska. Some of our Lincoln physicians are part of this with the CHI version, which is TM Health Partners, and Bryan Health Connect has now formed a similar network. What you see on this screen is a lot of green, so don't dive into numbers, but green means we're above average for the United States. So all of our ACOs, many of whom grew out of those medical home projects that Senator Glore pushed, are providing good care. There's nothing that prevents all this group from getting together and working together, one, to stop coronavirus, but then to remove some health disparities in Nebraska. Interestingly enough, that group had been meeting, and unfortunately, until the coronavirus derailed our last meeting, we were even working on a proposal that I proposed to some of the senators. During our last meeting, we talked about the fact that if we have this bad of disparities on influenza vaccination rates around the state, what does that say about our ability to respond should coronavirus be the real deal? Unfortunately, fast forward a couple months later, and coronavirus is the real deal. This group of folks was already convening underneath at the College of Public Health under leadership of Ali Khan, who will be interviewed, I think, tonight by Gunnar Ricketts. So this group could get together. Our goal was to remove health disparities and get Nebraska's rankings on America's health rankings. We've been sliding for years. We wanted to reverse that slide with this group, so we could put that group together again, convened by the state. One, get control of this coronavirus epidemic, but then take that relationship and fix a lot of other health disparities across the state as well. There are examples of this happening. This neutral convener mentality as opposed to government-run healthcare. This neutral convener mentality is what Germany, Switzerland, and the Dutch systems use. My hope for moving forward in healthcare in not just Nebraska but the whole country as we look at that approach. Uwe Reinhardt was the preeminent health economist for the country until he died last year, but he was actually arguing not for single payer but for Germany's all payer system, where the government doesn't run things but acts as a neutral convener. This is Germany and Switzerland and the Dutch systems are often some of the best performing health systems in the world. I think we should be looking at that model both in Lincoln and Nebraska. So lastly, okay, what do you guys do again? Again, how you get together. It's important that we get out and be healthy. Nice to be outside, but don't do it this way. Most spread still from coronavirus is likely in our hands. So fomites is what we call it in medical terminology. Things that are contaminated object, could be a frisbee, a basketball, or volleyball. So this type of getting together though is not okay. This type of get together is okay, or getting out. So be social with your friends in your neighborhood, but maintain your distance. Go on a bike ride, walk the dog. Those are all good, and they're a way to kind of keep our sanity for the next few months, especially as the spring rolls through. Get out with your neighborhoods. We do need to keep our communities together. And hopefully this is all helpful to you. Again, if you want to know where the past videos are, they are now on the healthylincoln.org website. And so you can go there, and I'll put this one on there in probably another couple hours.